In this video, we will learn about communication to better understand how we can master this necessary tool as healthcare professionals. Many years ago, I entered the world of quality management, where I found myself participating in hospital committees that reviewed patient safety events and complaints. Every mistake or error was reviewed to determine the cause. In most cases, more than 90% of all issues within the hospital were caused by an issue with communication. Either it was miscommunication, communication that didn't happen or wasn't received, or communication that was received but was ignored. Communication can be life or death in some situations. When communication is good, outcomes and satisfaction increase. Staff tend to be happier with better communication too. When communication is lacking, patients are not happy with their care, even if they are healed. However, on average, poor outcomes are experienced and some patients experience harm due to poor communication. Communication is at the heart of reliable healthcare. Now that we understand why communication is important, it's time to learn more about communication in general. For communication to take place, we need three things: a sender, a receiver, and a message. The message is sent via communication channel, and we will talk more about those options in a moment. For now, I want you to focus on the process. Communication is a two-way process. The sender plans, encodes, and transmits a message. The receiver receives, decodes, and interprets the message. The most crucial component of communication is a feedback loop. The sender can plan and send the most perfectly comprehensive message, but if the receiver never gets the message or misunderstands it, the message is lost. Feedback ensures the message was received as intended, but is often the misstep in communication. Many barriers can get in the way of effective communication, and we as professionals need to work to overcome obstacles in our communication, whether it's our emotions or noise. That could be a loud truck passing or a noise created by too many messages being received that the receiver becomes overwhelmed. There's also language barriers, cultural barriers, distractions, perceptions, or even physical barriers such as distance or talking through a door. It's important to understand the barriers as well as the types of communication. There are four main types, including verbal, nonverbal, written, and the ever-expanding category of electronic communication. Verbal communication is oral communication. It's the words that are stated. In oral conversation, one may expect that majority of the conversation is conveyed using verbal communication. However, that assumption would be incorrect. In fact, 83 to 96% of all conversations, even telephone calls, rely on nonverbal communication, also referred to as paralanguage. This is everything but the words and includes tone, inflection, volume, facial expressions, body language, etc. Nonverbal communication provides the context and the emotion of the message. The same word can mean different things depending on how things are said. For example, the word fine. If you ask me how my day is going, I can communicate more with how I say the word than the word itself. In fact, the word almost becomes meaningless. So, how is your day? I could say fine with attitude and anger. Or what if I say fine? What if I say fine? All the same word, but totally different response. The next two types, written and electronic, have similar limitations. The communicator has to anticipate how the receiver will decode the message because there's no feedback and there's limited context. Often we can see or hear the receiver's response, if they are comprehending the message, if it's making them angry or happy or sad. But written and electronic communication, it doesn't give us that immediate feedback as to how the message is being received. Sarcasm and jokes can be missed without the context clues of nonverbal communication. So keep this in mind when writing or typing a message. The main takeaway that I want you to remember about written and electronic communication is that in healthcare, clear, concise, complete, and timely communication is preferred. I'll take that one step further and encourage you to be mindful to keep your communication professional. Spelling, punctuation, and tone of written communication, whether handwritten or sent in an email, is important as well. In all communication, a plan is best. Set a communication goal and plan the message. What information is needed to be transmitted? Consider the needs of the receiver and the best method of delivery for that information. An email is not appropriate for an urgent patient need. An urgent patient need may be better suited as a face-to-face discussion or a phone call, depending on the receiver's location. Deliver the message and be mindful of nonverbal cues. What information can you gather from watching and listening? As I said before, sometimes you can gather clues about how well someone is comprehending the information, or if they are responding emotionally just by their facial expressions and posture. Evaluate if your words and paralanguage match. Are you sending mixed signals? Are you asking if the patient needs anything else or has any questions, but you are facing away from them with one foot out the door? Request feedback and ask for confirmation of understanding. Ask for a repeat back, but always allowing the receiver time to process and ask for clarification. And then lastly, evaluate that interaction. If you're unsure, request more feedback. If you have concerns, adjust your message as necessary. Maybe summarize the expectation or question, or maybe rephrase the information. Now that you have some suggestions on how to carry out well-planned and executed communication, let me provide some suggestions on what to avoid. What we see here are examples of actions that can be perceived as negative. The first one is something I do all the time, and that is crossing my arms. I'm always cold, and I have a tendency to do this. I simply inform the other person that my arms are crossed because I'm chilly, so that they know that it's not a reflection on them or what they are saying. The next is standing over someone. This is very common in healthcare because the patient is often seated or in a bed. So getting on their level is a sign of respect and may help the patient to feel more comfortable. This is especially helpful with children. For kids, I may crouch down at their level. For adults, I may just take a seat next to them. Parking myself in a chair next to the patient also communicates in a nonverbal way that I am invested in our time together. Rolling eyes and smirking, grimacing, furrowing our brows, etc. These are pretty much self-explanatory, but be cautious. Sometimes we are unaware of our facial expressions and can send unintended messages. Our appearance also communicates something. If we're looking a little sloppy, that's communicating a message that we may not have been intending. How you carry yourself, how you dress, wear your hair, how you smell, all of it's giving a message. Plan that message well. Poor eye contact is another challenge in healthcare. We are typically typing, taking notes, or inputting data while talking with our patients, and this lack of eye contact may communicate that we are not listening. Be mindful to tell your patient what you are doing. For example, you could say, "Mr. Smith, I'm sorry, but I'm going to be turned away slightly from you while I'm typing this information in the computer that you're providing. I want to make sure I'm entering accurately the information that you're telling me." And then make a point to look at the patient during the pauses. And lastly, cutting the patient off while they are talking. Sometimes this is necessary and you have to be crafty. I wait for a breath and transition back to the task at hand as smoothly as possible. For example, you could say, "Wow, Mr. Smith, it sounds like you've had a really busy weekend, an eventful day. So let me gather the rest of this information so we can get your doctor in here to check that ankle out." As always, watch your tone and inflection. If you've ever been told it's not what you say, but how you say it, that is a fact. Being mindful to avoid a negative tone can help in your personal, professional, and patient relationships. We can't talk about effective communication without encouraging you to be a good listener. And especially in healthcare, good listeners are empathetic. Here is a basic list to help you on your way to being an effective and empathetic listener, and it starts by avoiding arguments. Listening is not debating. Instead, focus on what is being said and the feelings of the person talking. Use open-ended questions to obtain more information. These are questions that can't be answered with a simple one-word answer such as yes or no. A good example is, "Tell me what happened." Listening is great, but being heard is validating. Show you are hearing what they are saying by paraphrasing. You could say, "So what I'm hearing you saying is that you never received the letter from the provider that you requested, and that caused you to be denied for payment by your insurance company." And lastly, give your full attention. Rushing someone and telling them to hold that thought to check a text while you are in the middle of, the patient bearing their soul communicates that you're not invested in the conversation. I was once in a job interview, and the interviewer was upfront that he was awaiting a very important phone call and that he couldn't miss it, and he may have to step out during that conversation. He explained the situation, which was appropriate, and when he had to step out, it didn't make me feel as though my time was less valuable. So being willing to communicate that information up front can help that interaction. Practice good communication techniques starting now. Use what you've learned in your job, at home, school, and when you're working in healthcare. Be aware of your communication and what others are trying to communicate with you. Listen intentionally and with empathy. Remember, communication is important and can mean the difference between excellent patient care and service and devastation and harm. Choose to never stop working on building better communication skills.